You're listening to the Doctor Is In podcast, brought to you by MartinClinic.com. During the episode, the doctors share a lot of information. As awesome as the info may be, it is not intended to diagnose, cure, treat, or prevent any disease. It's strictly for informational purposes.
There was a story that came out in the news, a Canadian story, but it certainly affects everybody in North America, and that is finally they're saying that they're using proton pump inhibitors. They were never meant, and those are things for acid reflux. So all those drugs, any drug that you're on for any kind of acid reflux, GERDs or whatever, are being used and way overused. They're not meant to be used for a long period of time. And finally, they're admitting that when you take that kind of a medication to suppress the acid in your stomach, and look, nobody wants to live with acid reflux, heartburn. It can be very disabling, and I understand that. But now they're saying, look, they were never meant to be used for a long period of time. And the reason is because, and I've written out 6 things here, that long-term effects of using a medication. I know people and patients that have been on these things 10 years, 15 years, 20 years for acid reflux. And what they're showing now is something that we've been saying at the Martin Clinic for many, many years. By the way, acid reflux is not that you have too much acid. You actually don't have enough, and your stomach is trying to make more acid to compensate. And that goes up from the stomach into the esophagus. And it can be very, very painful and no fun at all. But the number one thing that causes that low acidity in the stomach is a lack of enzymes, first of all, where the gallbladder and the liver and everything in the digestive tract is not working properly. And secondly, one of the biggest things that is happening is that people's insulin is way too high. So that is a common denominator when insulin resistance and you're eating too many carbohydrates, too much sugar, it actually causes the body to release much more acid. So, change the diet and get on digestive enzymes. Absolutely need those enzymes. But let me just show you what this story was saying. So I'm not only saying it, been saying it for years, but now even doctors are being told, quit prescribing this for many, many years. It's going to cause a malabsorption syndrome of vitamin B12. B12 is a finicky vitamin at the best of times. And if you're on any kind of medication, but especially any medication for acid reflux, a proton pump inhibitor, you're going to be low in B12, 100% for sure. The other thing is you're going to be low in magnesium, and you're going to be often low in iron. And that can be a factor in anemia, because you're not absorbing. You might be eating these things. You're eating red meat and you're getting B12 and you're getting hem iron in red meat. But if you're on a proton pump inhibitor, you're not even absorbing the B12, magnesium, and iron. These can cause major deficiencies in the body. One of the things that they're showing is that if you're on these things for a period of time, your bones don't get the amount of calcium they need, the amount of magnesium we already talked about. And again, you're not even going to be absorbing vitamin D properly, because these things block the absorption of these bone, very important nutrients that your bone needs. The other thing, this is fascinating, is that people that are on proton pump inhibitors are much more susceptible to dementia and Alzheimer's. Imagine that. And again, the reason is because you're not absorbing the nutrients that your brain needs for it to be healthy. So can you imagine? You might get rid of your acid reflux as long as you take care of you take the medication, but look what you're setting yourself up for: osteoporosis, dementia. They're showing now that even your heart nutrients You're much more susceptible to heart disease, heart attack, stroke because of proton pump inhibitors. This is very common, by the way. Proton pump inhibitors over a period of time make you highly susceptible to kidney disease and the loss of kidney function. Again, all due to the fact that you're not absorbing the proper nutrients and mineral. Another one, immune system. The immune system is decreased. We already talked about vitamin D, which is a real important vitamin for your immune system. But again, if you don't have, as this proton pump inhibitor suppresses the acid in your stomach, then you're much more susceptible to H. pylori, which is a bacterial infection of the stomach, or C. difficile. Again, C. difficile is a bacterial infection that's becoming commonplace today, and it's almost can't be treated by antibiotics. It's so resistant to antibiotics. And one of the big reasons we're seeing so much of it today is the fact that people are on these acid blocking medications. Again, they're meant to be used temporarily, and they should not be used long term. I really get upset with people that are on these things, and I am upset at their doctors for prescribing them without trying to fix the problem. So get on digestive enzymes, absolutely, with every meal. Change your diet. Again, because of what insulin does, lower your carbohydrates, lower your sugars. It's amazing what happens to those acid levels in your stomach.
You've reached the end of another Doctor is In podcast with your hosts, Dr. Martin Jr. and Sr. Be sure to catch our next episode, and thanks for listening.